Welcome to MED-MYSTIFY. Today we're diving straight into the fascinating pharmacological world of H1 antagonists. Look, if you've ever popped an allergy pill to stop a runny nose or soothe an itchy rash, you've already benefited from these little medical marvels. But how exactly do they work under the hood? In this explainer, we're going to completely demystify how these drugs block allergic cascades right down at the cellular level.
To help you lock in these 16 different drugs without feeling totally overwhelmed, we've structured this into a really logical roadmap. We'll quickly run through the H1 receptor blockers, the 6 families of antihistamines, ethanolamines and ethylenediamines, piperazines and alkylamines, phenothiazines and piperidines, and then wrap up with the all-important sedation spectrum.
Let's kick things off with part 1, the H1 receptor blockers.
So when you encounter an allergen, mast cells in your body basically burst open, releasing a flood of histamine. And when that histamine binds to H1 receptors, well, it unleashes a barrage of pretty uncomfortable symptoms. We're talking vasodilation, which makes you flush, increased capillary permeability, causing you to swell up, relentless itching, sneezing, rhinorrhea, which is just a fancy word for a runny nose, and even severe bronchoconstriction that makes it tough to breathe. It also triggers that classic wheal and flare reaction. You know, that raised, red, incredibly itchy welt you get after a bug bite.
Now, what's genuinely fascinating here is that these drugs aren't just passive blockers. Even though we often call them competitive antagonists, they're actually, more accurately, inverse agonists. Think of the H1 receptor as a lock, and histamine is the key that turns it on to trigger all those allergies. These antihistamines act like master keys that slide in and actively force the lock into an inactive state, rapidly shutting down all that swelling and itching.
Moving right along to part 2, 6 families of antihistamines.
Honestly, pharmacology can feel like alphabet soup if you just try to memorize a massive list of random names. But by chunking the 16 individual drugs into 6 chemical categories, specifically ethylenamines, ethylenediamines, piperazines, alkylamines, phenothiazines, and piperidines, we can easily predict their therapeutic effects and, crucially, their side effects.
Which brings us to part 3, ethanolamines and ethylenediamines.
We really have to start with the grandfather of them all, Diphenhydramine. The crucial thing to understand about ethanolamines like Diphenhydramine is their highly lipophilic nature. Because they dissolve so easily in fats, they shoot right across the blood-brain barrier. Once inside your central nervous system, they act heavily on H1 receptors in the brain, producing profound, marked sedation. We're talking a solid 4+ on our sedation scale.
And because they cross into the CNS so aggressively, this ethanolamine family is incredibly versatile. We don't just use diphenhydramine for allergies. It famously doubles as a sleep aid and a cough suppressant. Tweak the formula slightly to Dimenhydrinate, and boom, you have a premier motion sickness drug. Add Doxylamine to some vitamin B6, and suddenly you're treating pregnancy nausea. It's a really heavy-hitting family.
This brilliantly illustrates how a simple shift in chemical structure completely changes a drug's clinical profile. When we move from the ethanolamine family over to an ethylenediamine, like Triprolidine, the sedation level drops from a heavy 4+ down to a much more manageable 2+. You still get excellent relief for allergic rhinitis, but without completely knocking your patient out.
All right, let's look at part 4, piperazines and alkylamines. The piperazine family sits right in that sweet spot of moderate 2+ sedation. The absolute standout here is Meclizine. Because of its uniquely long duration and milder drowsiness profile, it is an absolute game-changer for treating vertigo and motion sickness. We also see chlorpheniramine used for skin hives and Meclizine uniquely applied as an appetite stimulant.
Now contrast that heavily sedating Diphenhydramine we talked about earlier with an alkylamine like Chlorpheniramine. If you've ever taken a daytime cold medicine and actually managed to stay perfectly awake, you can absolutely thank the alkylamines. They offer fantastic relief for hay fever and urticaria, but with only a mild 1+ sedation score.
These alkylamines are the massive staple behind almost all your over-the-counter daytime cold meds. Drugs like Chlorpheniramine and Triprolidine deliver highly potent histamine-blocking power, but with very low CNS depression. They essentially dry up your symptoms while keeping you totally functional and alert for the workday.
Next up is part 5, phenothiazines and piperidines.
Phenothiazines like Promethazine and Triprolidine are serious heavy hitters. Promethazine boasts strong antiemetic, which means anti-nausea, anticholinergic, and marked sedative effects. It causes a massive 4+ level of sedation.
This combo makes it absolutely ideal for pre-anesthetic medication in hospitals. Trimeprazine is pretty similar, offering a strong 3+ sedation that's incredibly effective for severe pruritus or intense itching, especially in allergic skin diseases where the patient just desperately needs to get some sleep.
Then we have the Piperidines, featuring drugs like Cyproheptadine. What makes Cyproheptadine so clinically fascinating is its dual action. It doesn't just block histamine, it's also a highly powerful serotonin antagonist. Because of this totally unique profile, its use goes way beyond basic allergies. It actually stimulates the appetite and provides highly effective migraine prophylaxis. Finally, let's pull it all together in Part 6, the sedation spectrum.
If we map out the top of the spectrum, we can clearly see that the 4+ and 3+ sedators are almost entirely dominated by the ethanolamine and phenothiazine families. Drugs like Diphenhydramine, Doxylamine, and Promethazine are incredibly useful, but you absolutely have to respect their ability to cross that blood-brain barrier. You prescribe these when you actively want the patient to sleep or when you're fighting off severe motion sickness and nausea.
Conversely, looking at the low sedation end of the chart, alkylamines and piperazines really rule the day. Drugs like Chlorpheniramine and Triprolidine sit firmly at a 1+, while Meclizine and Triprolidine hover right around a 2+. Understanding this spectrum is exactly what allows for effective allergy, cold, and vertigo relief without putting your patient to sleep right in the middle of their workday. Honestly, it's all about choosing the right chemical key for the right clinical lock.
Ultimately, mastering antihistamines isn't just about memorizing names. It's about mastering the central nervous system. So the next time you're recommending an allergy pill, ask yourself, are you just treating the symptom or are you managing the whole patient? Like, subscribe, and share for such more informative videos. Also, add comment topics on which you'd like to see the next video. We will catch you in the next one.